I'd like to call the House Health Committee for February 28th to order. Will the clerk please take the roll?
Representatives Bain, Boyd, Capley, Carringer, Clemens, Faison, Farmer, Gillespie, Hakeem, Hawk, Haynes, Hemmer, Hicks of Hawkins, Hicks of Washington, Hill, Jernigan, Kumar, Martin, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Chairman, you have a quorum.
All right, thank you. And before we get started, do any of the members have any personal orders? All right, seeing none, I do want to make an announcement. We did have a scheduling error. The Department of Health will not be presenting their budget today, and we are trying to get that scheduled as soon as possible. We got a calendar. We've got 14 items on the calendar today. Without objection, item number 8, House Bill 1922. Has been rolled 1 week. And item number 11, House Bill 2907, has been rolled 1 week. And without objection, I'm going to call up, we have a conflict here on different committees, going to call up item number 3, House Bill 647. Representative Baum, you are recognized. You have a motion and a second.
Thank you, Chairman Terry and members. In Tennessee Code, we have prices that patients can be charged for their medical records that are specified. This code was written at a time when these medical records were all paper, they were Xeroxed and mailed. And now a lot of medical records are electronic, and they can be copied electronically. They can be emailed to patients or their representatives rather than sent through the postal mail. And so what this bill does is it establishes a second set of charges in code that patients or their representatives could be charged for their medical records if those medical records are electronic. You may feel like you have heard this bill before. It actually did pass this committee last year. It made it to the House floor. It was at the end of session. When it got to the House floor, we realized that the charge for a notary was in the bill for the electronic records, but we had agreed to include it in the bill for paper records as well. It was a request by TMA. And so we asked for the bill to be re-referred back to Health. Health didn't open up, and so it's coming back today. This bill, though, is an agreement from several years' worth of work between the Tennessee Medical Association, Tennessee Bar Association, Tennessee Trial Lawyers Association, and representatives for SciOx, which is the company, the third-party entity that does a lot of the records providing when they're requested.
All right, and I believe we have an amendment that, is that correct?
Yes.
Amendment 14327, is that correct?
Yes.
Okay, and that does what you explained, that comes back. Okay.
It does. It does to the paper what we said we would do that's already in the bill for the electronic records.
Okay, you have a motion and second on the amendment. You want to ask your question before we put it on the bill? Okay. Okay, if there's no objection, we are voting on amendment 014327. All those in favor say aye. Opposed? Ayes have it. Okay, we're back on the bill as amended. Representative Hakeem, you're recognized.
Thank you, Mr. Chairman. Representative Baum, I'm trying to be clear. Are we saying the same price for paper as we do electronic or some other form?
You're recognized.
We are not. The set of prices for the electronic records are lower. And sort of the summary, if I had to give you one number to remember, there is a maximum charge of $90 for the electronic, not for the paper. The paper charges are higher. And this helps patients because otherwise it was not only theoretically possible, but I have invoices that show patients were getting charged as much as $6,000 for their medical records.
Okay. Thank you very much, Mr. Chairman and
All right.
Representative.
Thank you. Okay, if there are no further questions, We are voting on House Bill 0647 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you all.
All right. Thank you guys for that, your indulgence on that, and good luck next door. We are back to the top of the calendar. Item number 1, House Bill 2089. You have a motion and a second. Speaker Johnson, you're recognized.
Thank you, Mr. Chairman. Mr. Chairman, I do have an amendment.
Okay, let me find that here for you.
13985.
Yep, you have a motion and a second on Amendment 013985. You have a motion and a second on it. You are recognized.
Well, thank you.
Does this make the bill?
Yes, it does, Mr.
Okay,
Chairman.
well, if there's no objection, let's go ahead and vote on Amendment 013985. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. House Bill 2089 as amended. It's an administrative bill, and it merges the Department of Intellectual and Developmental Disabilities with the Tennessee Commission on Aging and Disabilities to create the Tennessee Department of Disability and Aging. The two councils will be administratively attached to the Department of Health.
Okay, Chairman Hawk, you're recognized.
Thank you, Mr. Chair, and Deputy Speaker, thank you for bringing this. This is a big piece of legislation, and I appreciate where we're coming from. And not too long ago, we were actually elevating DIDD from an assistant or a deputy commissioner position to a full-born department. So I think this is a good move. I just want to ensure, and I'll take a nod of the head, as we're creating a merger with our Commission on Aging and Disability, just want to ensure that the programs, our senior centers, the grants that are made available, and all the different aspects that our Commission on Aging and Disability has done for our folks back home. Just want to ensure those things continue. Understand there's going to be some seamless transitions of Alzheimer's care groups to Department of Health, and we're really finding a good home for all the aspects of that. I see 4 different heads nodding in the audience, 7 different heads nodding, 8 different. Okay, so just
I have a lot of friends with me today, Chairman Hawk.
so just a confirmation that this is a substantial move, but it really is elevating the Commission on Aging Disability to a deputy commissioner position, which I can envision in the days to come to becoming a full cabinet level position as well. So I want to express my support for this and thank you for the head nods in the audience.
That this will be a cabinet level agency.
Thank you. Representative Whitson, you're recognized.
Thank you, Mr. Chairman. Again, I feel this is good legislation. I talked to stakeholders in the Alzheimer's Disease and Related Dementia Advisory Council, and they are in full support of this legislation, and I fully support it, Mr. Chairman.
All right, thank you. Chairman Vaughn, you're recognized.
Yes, sir. Thank you, Mr. Chairman and Speaker. It's my understanding that this is growing the role and responsibility of our current DIDS Commissioner, Mr. Brad Turner.
You're recognized.
Would you repeat that, Chairman?
That all of this is going to be rolled underneath our existing commissioner, correct?
Correct.
If we can get that guy to work some more, I'm all for that. So that's a good man heading that group. So we're thrilled to
Thank you.
get more use out of him. Thanks.
Yeah, and as long as he's not rooting for Florida, this is going to be a good piece of legislation. So are there any further questions? Representative Bain, you're recognized.
Thank you, Mr. Chairman. Could you speak to the funding and how the funding will work with the merger? Will it just be doubled, or in terms of the budget?
You're recognized.
There's no physical impact on this bill.
Okay, thank you.
Any further questions or comments? Okay, seeing none, we are voting on House Bill 2089. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you, Mr. Chairman, committee.
That brings us to item number 2, House Bill 2690. Chairman Doggett, you are recognized. You have a motion and a second.
Well, good afternoon, Mr. Chairman, committee. Can I make a point of personal privilege?
Yes, you may.
Well, thank you. I have some constituents that are here in the room with us today. Miss Elena, Kevin, and Chrissy Hood are back there in the back. They'll wave or stand up. And so what we are about to talk about is spawned from a conversation that we had in my office about 3 years ago. And that was powered height adjustable adult changing tables. And so they had came and visited with us on the Hill that day, and they were late to our, I hope this is okay. Okay. And they were late to our meeting because there was nowhere for them to go use the restroom. And so with Elena, and so because she has needs that we were not able to accommodate here. And so she said if we had some powered height adjustable adult changing tables here, that would be very helpful. And there's none hardly anywhere in the state. And so thankfully through our finance committees in the House and in the Senate, we were able to create a grant program, which was the first program of its kind in our country. And so thankfully, we put $500,000 in there, and we started this grant program out at $5,000 each to help local businesses, municipalities, counties, nonprofits, churches, you name it. They would be eligible to apply for this grant program to utilize these funds to put these adult changing tables in their facilities. We also worked closely with TDOT and with the state parks through TDEC to help get these. They agreed that they were going to put these changing tables in their rest areas, in their welcome centers, and then in their 2030 plan to get through to the state parks to make them more accessible. Last year, we came back and this body approved, well, let me step back. We asked for 500,000. They actually put in $1 million. Last year, we came back and the body approved to continue this grant program. One of the things that we've noticed is that we've had a difficult time getting these grants distributed out to folks, not from anything from a state side, but it's more of those that are applying for the grants. Excuse me. The $5,000 just was not enough for them to be able to make the necessary renovations and yet get these tables into their facilities. And so we worked to bump that number to 10,000. We learned later that we needed legislation to help do this. And so that's what I have before you today. What we're doing is the Department of Intellectual and Developmental Disabilities are going to, in statute now, with this legislation, issue these grants subject to any appropriations that we as a body decide to allocate towards them in the support of these adult changing tables and the single occupancy family restrooms in privately owned buildings and municipalities that are open to the public across the state. It also is authorizing the commissioner of DIDD to create and convene, which is important, an ad hoc committee to help advise and assist with these grant applications. And so that's what we're doing with this legislation. We're trying to get this in the code so we can help get this money going and help get these tables more accessible across our state.
All right, thank you. Do we have any questions for the sponsor of the bill? Representative Hakeem, you're recognized.
Thank you, Mr. Chairman. Chairman Doggett, I don't guess I should say I have concerns, but are we going to distribute this by grand divisions, or one grand division is going to get all of the necessary assistance in these areas. You follow what I'm trying to say?
You recognize?
Yes, sir. Thank you. Mr. Representative, this is, we haven't divided them up amongst divisions. This has been on a first come, first served basis. So far, we have not exhausted those funds. And so that's why one was trying to increase the funding, but two, by putting this in code, we can help hopefully expedite that process to get them out. I can get you numbers as far as where these are gone, but we still have a lot of money left to distribute to help do this. And we're hoping that this, one, the financial incentive will help folks, but two, by getting it in code, it's going to help streamline that process a little bit more efficiently.
You recognize?
Thank you, Mr. Chairman. I didn't know if we had made any, it made this known to businesses throughout the state, the possibility of, utilizing these funds. And are you aware of any way of making everyone conscious of what's available?
Yes, sir. And thank you, Mr. Chairman. Yes, sir. There has been an effort to get that out there. A lot of the advocacy groups have done a fantastic job of making sure that this information is getting out there. And so it basically comes back down to that cost, because in order for an existing building that's going to do this, these tables are quite large, and for good reason. They can be used from anyone from birth to 100 years old, and so that's what's so unique about it. But we've got to have the facilities to be able to do it. So a lot of times folks will have to maybe extend restrooms by knocking out a wall or making some major renovative changes to be able to make this accommodation. And so that's where we're at. But the advocacy groups are doing great. I know that in your area alone, there's been several that have been installed since the creation of the grant program. So they're popping up all over the state. We just want to see it pop up even more and have access for folks who travel from Memphis to Mountain City, or from where I live all the way up into Leader-Lambert's district in Sumner County. So we're hoping to get this statewide.
All right. Thank you, Mr. Chairman. And thank you, sir.
All right. Representative Hill, you recognize?
Thank you, Mr. Chairman. Since Mountain City was mentioned, I wanted to thank the sponsor of this legislation for being so thoughtful, not only to include Mountain City, but also to have a passion for taking up something on behalf of the folks that visited you and trying to make government be something that it is rarely good at, and that is actually meeting a direct need and being compassionate. So, sponsor, thanks for bringing this.
Thank you very much.
All right, thank you. Any further questions? Okay. That was something I was going to bring up and echo. Some of the best things that we do, and I get kudos to your guests when something spawns out of self governance and these ideas and solving problems for our constituents. That's some of the best things that we do. So thank you for your participation in our republic. So without objection, we are voting on House Bill 2690. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman. If I may, Representative Helton Haynes might be able to tell you where you can see one of these today if you are so interested.
Yes, we have one on the ground floor, and it's awesome. We're just waiting to get a sink installed, but we have in East Ridge, Tennessee, we have an adult size changing table at Camp Jordan Park and also in our Welcome Center at Exit 1. So I'm proud to say we have 2 in our area, and we need to get these in as many places as possible.
All right. Thank you.
Thank you all.
All right. That brings us to item number 4, House Bill 2174. Representative Alexander, you are recognized. You have a motion and a second.
Thank you, Chairman, and thank you, committee. This bill is basically to allow, anytime we have a festival in the state, to allow establishments that don't normally sell food to be able to sell water. And it happens a lot at our storytelling festival. in Jonesboro, Tennessee, where we have establishments that are not food establishments, but they set up tents outside on the sidewalk of their business and they sell water and candy bars and potato chips as people are going into the festival. The only thing this bill does is it changes it from 1 day to 2 days. And the health department is fine with this, and that's my bill.
All right. Any questions for the sponsor of the bill? Okay. Chairman Clemens, you're recognized.
Yeah, thank you, Mr. Chairman, and I understand the purpose for the bill. And I just had a question. This 1/4 mile from the establishment that's serving the food, can you explain that?
Yeah.
You're recognized.
That just means an establishment that is past 1/4 mile of where the festival is cannot do this.
But it's got to be less than 1/4 mile from the establishment itself.
No,
that not right?
from the festival itself. You're a lawyer. I'm not,
Yeah, well,
and I could be wrong, that it's written wrong.
okay. I'll look at this afterward, after we pass it,
Okay.
which I have a feeling is going to happen. Thank you.
All right.
That wasn't in the intention
All right.
of it.
Question's been called. Without objection, we're voting on House Bill 2174. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means. All right, that brings us to item number 5, House Bill 2622. Representative Martin, you are recognized. You have motion and second.
Thank you, Mr. Chairman and committee. This legislation provides a pathway for an ambulatory surgery center to apply for a secondary license from the Board of Pharmacy. And with this Board of Pharmacy license, the ambulatory surgery center will be eligible to apply for an institutional DEA license. The institutional license allows for the facility to be licensed by the DEA. Currently, that license must be held by the medical director individually. This language was worked out with the Department of Health, and I would appreciate a favorable vote. I'm happy to answer any question that you might have.
All right, thank you. Any questions for the sponsor of the bill? I see none. I'm on the bill. I'm actually embarrassed that I didn't bring this up years ago. It's a great idea. So without objection, we are voting on House Bill 2622. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Chairman.
Okay. That brings us to item number 6. House Bill 2477. Representative Raper, you are recognized. You have a motion and second.
Thank you, Mr. Chair and committee. And good afternoon, by the way. The purpose of this bill is to assist local agencies with the hiring of EMTs. Currently in the state of Tennessee, we have a big shortage of certified EMT employees. They have many certifications and tests to pass in order to become a paramedic. And last year, for example, it cost about $175 for their entry-level test. What this bill would do is it would provide a one-time reimbursement for the license of the National Registry examination required for EMT certification. And I'm open for questions.
All right, thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, we are going to vote on House Bill 2477. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chair and committee.
Thank you. That brings us to item number 7, House Bill 1918. Representative Hale, you are recognized. You have a motion and a second. Yeah.
Thank you, Mr. Chairman and committee.
And I believe you have 2 amendments. One rewrites the bill and the other one amends the amendment. Is that correct?
Correct.
Okay. So, first amendment is 012705. Is that correct?
Yes.
Okay, you have a motion and a second on that. If there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. Okay, we are on the bill as amended. You have a secondary amendment that amends slightly amends the First Amendment, drafting code 014321. Is that correct?
That's correct.
Okay, if there is no objection, you have a motion, a second on that. If there's no objection, let's go ahead and vote on that amendment. All those in favor say aye. Opposed? Ayes have it. Now we're on the bill as amended. You are recognized, sir.
Thank you, Mr. Chairman. House Bill 1918 allows for private long-term camp rental sites to be able to evict people from the premises for certain violations. These are, if they're not registered guests or visitors of the campground, remains on the premises beyond the agreed upon departure time and date, defaults in payment of any lawfully imposed fee or charge, creates a disturbance that denies other persons their right to quiet enjoyment on the campground, or if they violate any state, federal, or local law. And if someone stays on the premises after being lawfully asked to leave, then they're guilty of trespassing. This bill and the amendment, the second amendment, what that did, after we were in subcommittee last week, the Department of Agriculture wanted to make sure that this exempted any state-owned lands, including buildings or other structures. So that basically excluded the forestry properties in the state of Tennessee. So with that, I stand for question.
Do we have any questions for the sponsor bill? Representative Hill, you're recognized.
Thank you, Mr. Chairman. So the conditions under which an individual could be removed from a given campground, explain to me, or I guess I just have the question. The amendment excludes state property or state campgrounds, but what we're doing here is it not something we're putting into law, something that a campground owner could set in their policies, and then if their policies were violated, then they could kick somebody out of the campground if they so chose. Could you just explain, kind of clarify that?
You're recognized.
Yes, that's exactly right. Right now, they don't have the rights to do that. And so this would just give them, they would have these policies. Of course, they are required to post some of their campground curfew, alcohol use, tobacco use. That's on them. But this just gives them a way, gives them some rights that they would know, whether it's in writing or given to them by signage of these are some of their, and then if they violate them, then this gives them the right to be able to remove them. There's nothing in statute right now that currently gives campground owners, privately owned campground owners, these rights. And so this is just giving them that right.
So
you're recognized.
Thank you, Mr. Chairman. So and again, I don't necessarily have an issue with your legislation, but if somebody participates in a private contract with a campground, I don't know that any of these things that you're mentioning wouldn't be in their policies, right? And so if you engage in that contract with the campground, and I'm not a big campground guy, but if you engage in those, if you engage with the private contract, are we not with this legislation coming over the top of that private agreement and saying, well, here's state law that we're putting teeth in somewhere? I'm concerned that we're putting teeth somewhere that we shouldn't be. And so I'm wide open to the legislation. I don't understand why we have policy now. We're going to have law at a campground on top of the individual policy. Help me get there, can you?
Well, just because you have a policy, there's no law. There was an instant, and this was brought to me because there was a county attorney in Jackson County that had a situation at a campground there, and the attorney told him, said, we have no law that to be able to arrest or to be able to remove or whatever. So that's why the county attorney and stuff, they said, we need something that gives you the right to be able to do this.
Okay, thank you.
Okay. Representative Capley, you recognize?
Thank you, Mr. Chairman. Sponsor, I'm definitely, I'm gonna vote for your bill. I just had a question. Section E says a person who is removed from a campground under Section D is entitled to a refund of the unused portion of any prepaid fees. Can you explain that a little bit? Because the way I'm reading it, if somebody gets kicked off, I don't think they're entitled to anything.
You
Well,
recognize?
I'm sorry. That was discussed back and forth, and the campground owners, and there were several that came and had some input into this. A lot of them have places on the river in our district especially, and others across the state. But what they were, the issue with that was that if somebody started camping on Sunday, let's say, and then they're removed on Monday for violation or whatever, then they were at least willing to give them back that portion. I agree. You would almost think that, hey, if you violated, then you lose that money because they're not going to be able to, unless somebody else just comes up all of a sudden, they're not going to be able to. But the owners were willing to say, hey, we want to, whatever remaining money there, we're willing to give that back to them.
Representative Hakeem?
Thank you, Mr. Chairman. Just a point of clarity, if you would, please. Would this be the camp owners removing people or law enforcement, or maybe either one?
You recognize?
It could be either one. If they didn't, it gives the campground owners the right to remove them, but if they don't, then they could call law enforcement to be able to remove them because now they would have law to be able to back that up.
Thank you, Mr. Chairman. Thank you, sir.
I think
Thank you.
Chairman Hawk.
Thank you, Mr. Chairman. And the question has been, why did this bill come to the Health Committee when it's more about practical business application? There is a posting mechanism that is part of that, which is why it has come to the Health Committee. So it is a bit odd. And I'll try to go down the rabbit hole a little bit of the right of removal by contract that the campground owners may have is worth a piece of paper, and it can become very cumbersome to enforce the removal of someone should they violate the contract that's there. What this does is give the private owner of the campground, and correct me if I'm right or wrong on this, it gives the owner of the campground the ability to bring law enforcement in, and criminal trespass is what we're creating with this piece of legislation. Is that accurate, Representative?
You recognize?
That's correct.
You're good.
Thank you. And if I could, if this bill were to meet a positive vote, if I could request of legal staff, we've got two amendments that could travel together. Could we merge those two amendments into one, just for ease on the floor as they're being discussed, Chairman?
Without objection, let's go out of session.
Caroline Miller, Office of Legal Services. If that's okay with the chairman, I think that's something I can do.
I'll make that recommendation that if the bill does meet approval, that we merge these amendments into one for the floor, Chairman.
All right, we are back in session. All right, any further questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 1918 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules. And Chairman Hawk, you recognize? Oh. Did you want to ask about the rolling bills? Without objection, legal services, if you would roll the two amendments into one amendment for the House floor. Without objection. Thank you. All right, that brings us to item number 8, which has been rolled 1 week. That brings us to item number 9, House Bill 2900. Chairman Kumar, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman and members of committee. Because of the physician shortage in the state of Tennessee, last year we passed a bill to allow qualified physicians from international countries to get a temporary license to practice in the state of Tennessee if they meet certain qualifications. After practicing under supervision for 2 years, they would qualify for a permanent license. This is a clarification in the sense that before they apply for a license, the department requires that they either have a valid visa to come to the United States, or they have applied for a visa and visa application. And that is the main clarification of this, that the point is visa application and visa first, then seeking a job at a qualified institution in the state of Tennessee, medical center that has a training program, and then being able to come work for 2 years and be able to get functioning license to practice in the state of Tennessee.
All right. Thank you for that explanation. And we do have an amendment 014354. Is that correct? You have a motion and a second. And that amendment is the one that clarified that this was only for physicians. So, correct?
Yes, that is right. Thank you.
If there's no objection, let's go ahead and put that on the bill. All those in favor of Amendment 014354, say aye. Opposed? Ayes have it. We are back on the bill as amended. Do we have any questions for the sponsor of the bill? Chairman Clemens, you're recognized.
Yeah, thank you, Mr. Chairman. What are we doing with this piece of legislation? What's the intent behind this?
The intent is basically, thank you, Mr. Chairman. The intent is basically that there is a relative shortage of physicians, and there are delays and difficulties in allowing qualified international physicians to come to the United States. So Tennessee is taking a lead on this matter, and what we are doing is that if the physicians have practiced for 3 to 5 years in their home country, they are qualified, and then they can apply for a visa, which anybody can. Once they have applied for a visa, they can seek employment within the state of Tennessee. The employment has to be at an institution that has a training program, so that they would be properly supervised. Once those training programs and those medical centers will also verify their qualifications, and if they are willing to provide them with employment, and then the visa comes through, they can come to United States to work in that medical center. At that time, they will have a temporary license for 2 years. If they perform well for 2 years, then they qualify for a regular license to practice in the in the state of Tennessee. Now, they would have a basic license to practice. They would not have a specialty license. If they were a surgeon, they would still have to go through the further training and qualify to practice as a surgeon.
Chairman Clemens?
Thank you, Mr. Chairman. Thank you.
All right. So clarify, you ran this bill previously, went through, and these are some clarifying languages dealing with the timing of the issue between getting their visa and their temporary license, and then when the temporary license actually went into place, correct?
That is true. Just a matter of clarifying the timing and the sequence.
Thank you. Any further questions for the sponsor of the bill? Chairman Leatherwood, you're recognized.
I'm just curious why we're not adding the Amendment 1 that would have rewritten and added some presenting 2 forms of documentation and so forth, following the SAVE program. Just curious why we're up. And
I can answer that.
chairman is ready to go.
Yeah, that Amendment 1 expanded beyond physicians, and this is strictly for physicians, and that's why did not put that amendment on there.
Thank you.
All right. Any further questions for the sponsor of the bill?
I just want to thank the chairman. He has taken personal interest in it and has made sure that all the I's are dotted and T's are crossed. Thank you.
All right, thank you. Seeing no further questions, we are voting on House Bill 2900. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right, and that brings us to item number 10, House Bill 2901. Chairman Kumar, you are recognized. You have a motion, a second.
Thank you, Mr. Chairman. Members, under present law, if a person has a serious mental condition or a serious emotional distress, they may be detained for evaluation and treatment of their mental health condition. If they also pose an immediate threat to themselves or to others. For the purpose of mental health examination and care, immediate threat is the current standard. This bill, House Bill 2901, changes the word immediate to imminent. This will allow additional time for law enforcement, first responders, and mental health professionals to be able to capture the situation and be able to get timely treatment for the person who has a mental health distress or an acute condition to prevent a tragedy from happening. The difference between immediate is that it is happening now or at the time, and imminent is that it is about to happen or it is happening real soon. Thank you.
All right, thank you. And for the committee, we did pass this in special session, and so you've heard this before. So do we have any questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 2901. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to count and rules. Thank you, Chairman Kumar. That brings us to item number 12. Chairman Jernigan, it's House Bill 1610. You are recognized.
Thank you, members.
Can I get a,
I guess
you have a motion and a second.
Okay, I was waiting to make me a little bit nervous. This bill was brought to me by the Tennessee Massage Therapy Association, and it will raise the number of curriculum hours for eligibility to be licensed in massage therapy, body work, and somatic therapy from 500 to 650 hours. The reason for the request is due to the recent federal rule change within the U.S. Department of Education that will go into effect this July. The rule change, if we stay at 500 hours, will result in students losing their federal financial aid opportunities and in turn, a severe impact on current school enrollment. With that explanation, happy to answer any questions, Chairman.
All right. Do we have any questions for the sponsor of the bill? All right, seeing none, we are voting on House Bill 1610. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules. That brings us to item number 13, House Bill 2365. Chairman Carringer, you are recognized. You have a motion and a second.
Thank you, Chairman and committee. Wow, we got to me. That's awesome. House Bill 2365 is really a simple bill. What it does is authorize members of the Council on Autism Spectrum Disorder Council to receive reimbursement for travel expenses incurred for attendance at meetings of the council. The council already exists, and they would only be submitting like for their travel. There's 18 on this council, and 9 of them are already representing state agencies, and theirs is already, their travel is already paid for. So anyway, that's what my bill does, and I'll stand for questions.
Any questions for the sponsor of the bill? That question's been called. We are voting on House Bill 2365. All those in favor say aye. Opposed? Ayes have it. Bill goes on to Finance, Ways, and Means. That brings us to item number 14, House Bill 1669 by Representative Bain. You are recognized. You have a motion, a second.
Thank you, Representative Faison.
And we have an amendment. Is that correct?
Yes.
Drafting code 013594. That is correct?
Yes.
Okay. We have a motion, and a second. If there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. Amendment goes on the bill. Representative Bain, you are recognized.
Thank you, Mr. Chairman. So this is the daycare closing notice bill, which stipulates that daycare facilities regulated by DHS must give notice as early as practicable to parents and guardians of enrolled and waitlisted children before permanently closing their doors. The lack of accountable daycare is a problem for Tennessee families. In addition to all of these hoops, these facilities, which have struggled to keep up with Tennessee's booming population, can close with little to no notice, leaving families scrambling. This bill was brought to me by a few families, including constituent Tyler Brasher from Donaldson, who was on a wait list for 10 months before being accepted. This summer, his childcare facility gave them 6 days, not weeks, notice before it shut down. And this is his quote. Our daughter Millie was on the waiting list for her daycare from when my wife was 5 months pregnant until she was about 6 months old. About a year later, her daycare suddenly closed. Her mother and I received only 6 days' notice that we would soon lack childcare. We both work and were put in a position of scrambling to find replacement care. It puts working families in a bind. The strain of sudden daycare closures placed on working families can be relieved by requiring sufficient closure notice to parents and caregivers. I'd like to say that this bill would adopt the statute that Kentucky currently uses, which is instead of the original timeline of 60 to 90 days, this statute includes as early as practicable, which allows for facilities with various contingent plans. Thank you.
Do we have any questions for the sponsor of the bill? All right. Seeing none, is this, Representative Bain, is this your first bill?
Yes.
All right, thank you. I appreciate your first bill, and I do want for the audience out there to know that Representative Bain worked diligently with our committee and our sub-chair on this piece of legislation, and appreciate the work that she did put in, and look forward to the presentation, if this gets a favorable review in this committee, your presentation on the floor. So without objection, we are voting on House Bill 1669 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to calendar and rules. If you'd like to be recorded as a no, please notify the clerk.
Thank you, Mr. Chairman.
Thanks. All right. All right. Seeing no further bills on the calendar, no business before us, we are adjourned.